Hello. On behalf of the Employer Commissioners Bargaining Health Benefits for Vermont Public School Employees, I'm going to take a few minutes to talk about actuarial value. Actuarial value is a term that was introduced to most of us when the Federal Affordable Care Act became law in 2010. It's a quick way to compare health plans and their relative value to each other, regardless of plan design. All health plans have out-of-pocket cost responsibilities for the individuals and families that are enrolled in the plan. These include copays, fixed dollar amounts paid at the time of service, deductibles, which are larger dollar amounts usually billed after the service, and coinsurance, which kicks in once a deductible is met. Coinsurance is when the individual pays 20% of a service and the insurance company pays 80%. Regardless of how the out-of-pocket cost is designed on a health plan, AV allows for apples to apples comparison. It's an easy benchmark to compare health plans. What does AV mean? It tells you on average what percent of medical and pharmacy claims will be paid by the insurance company and what percentage the individual will be responsible for themselves. On Vermont Health Connect, plans range in value from 60% to 90%. The richest plan on Vermont Health Connect is a platinum plan with an actuarial value of 90%. This means that 90% of a person's claims, on average, will be covered by Blue Cross Blue Shield of Vermont or MVP, depending on the company that you use. And the individual in that plan will be expected to cover about 10% of the costs they incur. In a bronze plan, on the other hand, only 60% of the claims are expected to be covered by the insurance company and 40% are covered by the individual. Note that the higher the actuarial value of the plan, the higher the monthly premium has to be paid by the individual, so that the insurance company will have the money to pay for those claims. Here's another way to look at it. If you're enrolled in a platinum plan, you pay a higher monthly premium and you can expect to pay only 10% of whatever medical and pharmacy care you need and count on the insurance company to pay the other 90%. When it comes to school employees, VEHI acts as the insurance company. VEHI is collecting the premium and VEHI is paying the percent of claims covered by the plan. You should know that VEHI pays 100% of preventive and wellness medication the entire year without any out-of-pocket cost from school employees. The other thing we need to keep in mind with school employees in Vermont is that employers are obligated to provide an HRA in addition to the health plan. An HRA covers some of the out-of-pocket costs that VEHI does not. So when looking at actuarial value for school employees, we need to look at both what VEHI is paying and what the HRA is paying. That way we can know the percentage of claims that employees themselves are responsible for. This chart is a comparison for public school employees in the past, current, what's being discussed in negotiations, and a look at Vermont state employees as another comparison. In 2017, the vast majority of school employees were in the VHP plan. That was a 95% actuarial value plan, and it had no HRA. The employer did not help at all with copays, deductibles, or coinsurance. That was entirely paid by the employee when the bill arrived or at time of service. If you look at the state of Vermont employees, they have a plan of approximately 95% actuarial value, and they do not have any help from the employer to pay for their out-of-pocket costs. Just like in the 2017 VHP, state employees today are asked to pay all of the out-of-pocket costs themselves. Currently, as awarded by the arbitrator, licensed staff in public schools have an actuarial value of 97.5%. This includes the HRA. Unlicensed employees have an actuarial value of 98.1%, taking into account the HRA. The HRA raises the actuarial value of the Gold CDHP, which is an 84.4% plan, to a 98% plan. Employees have the benefit of paying a lower premium because the premium is pegged to the Gold CDHP 84% actuarial value plan, and get the benefits of the high AV plan because of the HRA. What the employer commissioners are currently proposing is that the employees have an actuarial value of 93% starting in 2023. Employees would continue to have the benefit of a first dollar HRA, but what the employer commissioners are asking is that employees have a small amount of deductible and a small amount of pharmacy exposure before the coinsurance kicks in. This plan, we believe, is comparable to a higher 95% AV plan that employees enjoyed in the past because of the HRA covering the first dollar and employees needing to use a fair amount of health care before their responsibility kicks in. In contrast, the employee commissioners are currently proposing to further reduce the out-of-pocket cost responsibility for employees and increasing the actuarial value of the plan to over 98% and approaching 99%.